Let's continue with diagnosis according to Zanko organ patterns. This time we discuss phlegm heat in the lung. Phlegm heat in the lung will often have developed from other lung imbalances. Damp phlegm in the lung can easily transform into phlegm heat in the lung because either there is already heat in the lung or the stagnation that is created by the phlegm will generate heat in the lung. The difference between this pattern and damp phlegm in the lung is that there are heat symptoms and signs. The pattern of lung heat can also be a precursor of this because heat in the lung can condense fluids and thereby lead to the formation of phlegm heat. It is important to note that phlegm heat does not necessarily sticky. This is due to the heat condensing fluids so that they become thick and sticky. When the phlegm is yellow or greenish, the heat will be more intense. Now let's take a look at its etiology. Phlegm heat in the lung can arise if there is an excessive consumption of foods that create phlegm or heat. Example of these foods are dairy products, sweets, sugar, alcohol, wheat, fried food, too much red meat, spicy food, and chocolate. Very cold food and beverages or raw vegetables can be involved indirectly because they can weaken spleen and qi, thereby leading to the creation of dampness and phlegm. Invasions of exogenous pathogenic qi can create both phlegm and heat in the lung. Air pollution, especially tobacco smoke, can be an important etiological factor. This is seen in many people who smoke tobacco developing a smoker's cough, having difficulty breathing, and easily becoming breathless. Stress can create heat in the body, and emotions such as anger, irritation, and frustration can generate heat in the liver that then rises to the lung and creates heat here. So what are its symptoms and signs? There is loud and noisy cough with sticky sputum and cough that is worst in the mornings. There's yellow or greenish sputum. The sputum can also sometimes be white, but it will not be watery or loose as the sputum is thick and sticky. There may be blood in the sputum. There's chest oppression, a sensation of heavy weight or a stone lying on the chest. There's shallow breathing or wheezing and shortness of breath or slight breathlessness. There is also a gravelly or hoarse voice, phlegm in the throat, thirst, a foggy or heavy sensation in the head, especially in the morning. There's aversion to heat, lips, red tongue with thick sticky yellowish coating, and fast, slippery, and full pulse, especially in the right lung position. The key symptoms here are loud, productive cough, shortness of breathing, yellow, sticky tongue coating. For the treatment principle, we drain phlegm and heat from the lung and regulate lung qi. In our acupuncture treatment, we can choose from lung 1, lung 5, lung 7, lung 10, LI11, UB13, DO12, DO14, stomach 40, and REN 17, and use the draining needling technique. A further explanation on the choice of points. Lung 1, lung 5, and UB13 regulate lung qi and drain phlegm and heat from the lung. Lung 10 and DO12 drain heat from the lung and regulate lung qi. Lung 7 and REN 17 regulate lung qi. LI11 and DO14 drain heat, and stomach 40 transforms phlegm and opens the chest. A relevant advice for a person with phlegm heat in the lung should also avoid consuming food that creates heat, dampness, and phlegm. This includes dairy products, sweets, dried fruits, sugar, alcohol, fried food, chili, pepper, garlic, chocolate, and lime. Smoking should be discouraged, and the person should avoid other forms of air pollution. Phlegm heat in the lung can be caused by the following patterns of imbalance: damp heat in the lung heat, spleen Qi deficiency, and invasion of exogenous pathogen Qi. In turn, this can result to spleen Qi deficiency, blood stagnation, lung yin deficiency. To summarize, phlegm heat obstructing the lung has its etiology in an invasion of exterior heat depressed in the lung and transforming into heat, internally produced heat from yin deficiency or Qi stagnation from long-term emotional strain, excessive consumption of greasy and cold raw foods. The possible presenting conditions are bronchial asthma, acute bronchitis, pneumonia, pulmonary emphysema with infection. Its signs and symptoms: cough and panting, barking cough with profuse, sticky yellow or green sputum, shortness of breath, sweating, flaring nostrils, expectoration of blood and or purulent phlegm with fishy smell, wheezing, feeling of oppression of the chest, feeling of heat, thirst, insomnia, and agitation. The pulse will be slippery and rapid, and the tongue red, swollen with a sticky yellow coating. For the treatment principle, we clear and drain phlegm heat. And for our acupuncture treatment, we can use the following points: lung 5, which clears heat and phlegm; lung 10, which clears lung heat; bladder 13 supplements lung Qi; stomach 40 resolves phlegm; Li4 releases the exterior; stomach 36 transforms phlegm; lung 7 restores lung descending function; lung 11 clears lung heat; Ren 12 supplements spleen and resolves phlegm; lung 1 descends lung Qi and alleviates cough; Ren 17 unbinds the chest; kidney 6 disinhibits the throat. We needle these points with drainage and we prick Li1 to bleed. Thank you for your attention.